Hey guys, welcome. I just want to check that I'm live and I'm audible. So if you're here, if you're with me live, then please let me know in the chat. Just give me a second. Oh, okay. I think we're good. Yes, we are. Okay. Hi, hello there. Welcome everybody. I'm Dr. Sylvia. Thank you so much for joining me. If you're catching this stream live or if you're watching on the replay, a very short one today. We're just going to tackle one question. What we usually do in these live streams is, well, yes, talk about different, health related issues, but I love addressing questions that have come into me during the previous week from one of our viewers. And I've got a really interesting one, which I felt that we could tackle today. How are you guys doing? Have you had a good first week in May? And we are here in the UK. It's a May bank holiday, so no work today for some of us. Work continues for the rest. But yes, if you're here watching and you're very much interested in the topic, which is looking at treatment options for a 22 centimeter fibroid, give this video a like. And I'd love to hear your thoughts or questions. What are your issues around this particular fibroid size? We're going to talk about some of the things I think are important to know, and then, address the specific question that this viewer asked. But just a quick word about disclaimer, reminding you, please, that we're here providing health information, not giving medical advice, because really that's not possible without knowing your other medical history or other medical background. But it's good to provide information that is based on research, based on genuine health information that research has found, that we can use to have informed conversation. You can use to advocate with your own medical provider. So yeah, that's out of the way. Have I said give the video a like? I have. And subscribe? I have. So if you haven't, go ahead and do so. So anyway, today's question, and we're not going to be here for too long because we're just tackling one question today. Today's question, I'm going to put it on the screen so that you can see what we are working on. Thank you so much to the lady who sent in the question, and they say, can you please recommend possible viable procedures for large fibroid removal, 22 centimeters to be exact? So that is today's question. Please recommend possible viable procedures for large fibroid removal, 22 centimeters to be exact. That is what we're going to be considering. So let me take that away. We have lots of videos regarding fibroids on the channel, a very important health condition, gynecological condition for women. Fibroids, as you know, are benign growths that develop or arise from the muscle of the womb. And it's such a common problem that by the time women get into their 50s and 60s, we think that 70-80% of women have fibroids. But it can happen and does happen very commonly in women in their reproductive age. And around that age, so that from the 20s, mid-20s into the mid-30s, possibly 3 in 10 women have fibroids. So fibroids will develop as we grow older. And we used to think that they shrink after menopause. That we don't believe that anymore, because even after menopause, there are many women who have fibroids, large fibroids, who even struggle with fibroid symptoms. So there's still so much about fibroids that we don't know. But we do know that their development is somehow associated with estrogen and progesterone imbalance in the body. We know that there are certain conditions that can increase, having fibroids. We know that diet can be related to it, weight can be related to it, smoking can be related to it. So yeah, we also know that there are particular, ethnic groups or races where fibroids appear to happen more frequently. For example, blacks. I'm not saying it doesn't happen in other women. I'm just saying that we found that they do tend to happen more frequently in black women. But anyway, that's a little bit about background of fibroids. This question is the reason why I have brought this into my studio today, or into my clinic today. I hope you can see me clearly. It looks a bit dark here, doesn't it? But I hope you can see me clearly. So I've brought this watermelon, because I want us to talk about size, which is really what the question is around. What is the size of the womb? If I asked you the size of your womb, what would you say to me? So again, I'm putting this up away from my face. Okay, so this is my womb model, which, yeah, hopefully you can see this very clearly. Let me just lift it up to the camera, so hopefully you can see this properly. Now, this is actually sort of adult sized womb model, and it's basically, if it were cut in half, I know that sounds really disgusting, but just for the sake of our explanation, please bear with me. If we cut it in half and the womb is open, this is what you'll be seeing. So this top bit is the muscle, top bit of the womb. Inside is the womb cavity where the baby grows. And the sides, this red, and on the other side as well. And the other side as well is a muscle of the womb. And then below, so this long channel here is the vagina. So actually the womb is from here, where my finger is at the moment, to the top bit here. That's the fundus of the womb. So that is the length of the womb, about 7.5 centimeters in the normal adult, non-pregnant woman. To the corner or to the sides, on both sides, you have the ovaries. So these yellow structures on both sides are the ovaries, and the fallopian tubes coming from the corners of the womb. So this is normal in terms of the womb. And fibroids can grow to different sizes. They can grow in different aspects of the womb, and they can grow in different sizes. I don't want to sort of dive too far. I want us to just be focused on the conversation, which is around the size of the womb, although where the fibroid is located is also quite important, because you can have fibroids that get jut into the inner lining area from the muscle, and they're called submucosal fibroids. You can have the ones that sort of butt outside, so coming from the muscle, but they're butting outside, called subserosal fibroids. So they're butting out into the rest of the pelvic area. And then you have the ones that are sort of sitting just within the muscle, and we call them the intramural fibroids. Again, lots and lots of videos on the channel where I sort of break all this down, but those are the different types and nature of fibroids, and they can be important. The ones that are most likely going to cause problems with fertility, for example, tend to be the ones that are submucosal, because they're sort of jutting into the air cavity where the baby will grow. But fibroids can also cause problem if they're sort of sitting on close to the fallopian tube opening, and pressing on the tube, closing it. They can also cause problems. Small fibroids can cause problems. Big fibroids can cause problems. So like I said at the beginning, a very important condition. But today we're tasked with looking at how a large fibroid, now this watermelon I've got here is bigger than 22 centimeters. But I just wanted it, well, it's slightly, it's just about 20, this is actually about 20 centimeters in length. And I'm struggling to hold it because, again, it's also quite heavy. This is probably just under 5 kilograms. And I just want you to imagine how somebody who has a 22 centimeter fibroid, I just want you to imagine, experience discomfort, pain. Sorry, I'm moving around so I can just, let me move back a bit so I can have both of them in frame, and hopefully you can see if I lift them up. So if this is the, this is the normal womb, imagine the watermelon. Block out my face now. Imagine the watermelon. Now, of course, we know that the womb can stretch. The womb can stretch bigger than 22 centimeters in pregnancy. But that's pregnancy. This is a fibroid that is growing in the womb. So the question has come to us. Let me put it up again for you. So the question is, please recommend possible viable procedures for large fibroid removal. So I thought, let's go through possible removal. Let's go through possible options. If you've talked about fibroids or have fibroids or know somebody who has fibroids, that there are different treatment options, and we have them grouped into options such as surgery or medication or surgery alternative you may have heard, or even the natural measures. And I'm going to touch on each of them and say whether or not I feel they would be appropriate for treating a 22 centimeter fibroid. Okay, so let us start with the one that is most common and most likely that will be mentioned by a doctor, a specialist talking to you about fibroids. And before I do that, let's talk about possible symptoms. Okay, so fibroid symptoms, commonly abnormal or irregular heavy pelvic menstrual bleeding, with or without pelvic pain. But I think that if somebody has this in the womb, I know that they will be experiencing a lot of pain. That can be pain in the pelvis, pain in the back, pain that might be going down the legs because of the pressure of the fibroid pushing against the nerves. They might have problems like bloating because this structure, this mass is going to be pressing against things like their bowels. They may have problems with the bladder, passing urine, so many different issues. Of course, fertility, for different reasons. Maybe it's blocking the path that the egg will use to travel within the fallopian tube. Maybe it makes them uncomfortable, makes somebody uncomfortable. They don't want to have sex. So there are different things that is fibroid size like this will cause. You need to see the back. You need to see my office with this fruit sitting here. All right. So in terms of treatment, let's talk about that. So the first thing that any specialist to be thinking about is actually removing this fibroid. So that is surgery. Okay. And I have to say, and I think we should be very clear, that coming to sizes like this is not a 1 centimeter fibroid. Even a 1 centimeter fibroid, depending on where it's located, could potentially cause problems. So if I take you back to this model here, even a 1 centimeter fibroid sitting here or sitting right at the top, I'm trying to position myself in front of this thing, sitting right at the top, or even sitting somewhere here, or perhaps sitting here, even a 1 centimeter fibroid could still cause problems. But the degree and the way that you would treat the degree of problem and the way that you treat that 1 centimeter fibroid compared to how you would treat a 22 centimeter fibroid are quite different. So your specialist might talk about surgery. Surgery might be the first thing that they say, this is the only way. And you may hear that, let's be very honest, you may hear that this is the only way to treat this problem. Now, what are the types of surgery? There is, of course, the myomectomy. Myomectomy means removal of the fibroid. So the womb is left intact. And of course, it's a preferred measure if we want to preserve fertility. So for a lady who has not had kids yet and still wants to have kids, then a myomectomy is the option. And this is the go-to surgery for large fibroids, big fibroids, where the doctor would probably do something like what's called an abdominal myomectomy. They'll make a large cut into the abdomen to remove the fibroid itself, while still maintaining the normal architecture, shape, and hopefully function of the womb. So it's really a suitable surgery for very big fibroids if there are plenty of fibroids. Of course, any procedure has its downside. So with a major surgery like this, you can expect that it might take 4 to 6 weeks for you to recover, bounce back to being able to move around normally without pain, and get back to normal. And it has a high success rate. But then I want us to be clear about possible downsides. It may be that you might end up with some scars in the area in the womb after they've done the surgery. It may be that you might need to have a C-section to deliver pregnancies. So if this fibroid is in such a location where what it was doing was causing pressure, it wasn't causing any damage to the tube, it wasn't blocking the path of the tube, wasn't pressing on the ovaries and causing any damage to the ovary. If it's removed, then you're able to fall pregnant. And so it may be that thanks to the previous surgery that's already been done, the risks will be lower for you to have a cesarean section instead of to try a vaginal birth. Again, this is something that should be discussed with your doctor, and it varies from woman to woman, depends on the degree of the surgery, the kind of cuts that you had into the abdomen and into your womb as well. So effective surgery, there's some issues that come with it, but it's a matter of pros and cons, because at the end of the day, the fibroid is removed, leading to improvement in symptoms, reduced heavy blood flow, so not being anemic, and all those other things I talked about. And what else? The other thing is the possibility of the fibroid coming back. And I think it's important to be upfront. I think all our specialists do that, but really important for you to be aware of the fact that even after you've had the surgery, the fibroid could come back. So I'm talking about the abdominal myomectomy, which is one really primarily the go-to surgery that your specialist might suggest for large fibroids, and we're talking about fibroids sort of this size. The next type of surgery is something called a laparoscopic, or they may talk about a robotic surgery. Now, let me just explain it first, and then whether it's suitable for large fibroids. So this is surgery where they may use very small cuts. So you're not going to have a big one, like in the abdominal myomectomy. In the abdominal myomectomy, you'll be treated, the cut you have is similar to if you were having a C-section, for example. With laparoscopic or robotic myomectomy, you're still going to have a myomectomy. The aim is still to remove the fibroid, but they're using small cuts into the abdomen to approach the womb. Again, it depends on where the fibroid is located and how easily they can access it through the abdomen. My concern, and I think the concern of many specialists, is how are you going to remove a big structure like this with small cuts on the abdomen? For those of you who have seen or know what a laparoscopic procedure looks like, is tiny cuts that have been made into the abdomen, the wall of your abdomen, and then to access the womb, they'll put a camera, a small tube with a camera at the end that helps to see inside the womb, inside the abdomen itself. They're looking at a scan, and then for the robotic one, it's tools that the surgeon or the specialist is handling while the tools are passed within your abdomen to try and cut away the fibroids. My concern, like I said, is that this fibroid is quite big and you may not successfully remove the fibroid or may only be able to remove parts of it. There's a procedure that they call morcellation, which is where they're trying to break up the fibroid. And I think it's controversial. I really feel that many surgeons or many gynecologists would not want to go down the route of a laparoscopic surgery or robotic surgery to remove fibroids of this size. It is controversial, to be fair, so it's worthwhile having a discussion with your doctor. But I would be concerned about the procedure, its success. Even though laparoscopy is it's a procedure that's meant to reduce the downtime or the recovery time from major surgery where possible. So there are some things that you can achieve using laparoscopic or robotic surgery. But no, in this particular instance, with this size of fibroid, I would not support it. I wouldn't recommend it. What other surgery is there? Somebody might talk about cervical, what do you call it? Myomectomy. Again, that's a myomectomy that is being performed through the cervix. So let me just pull up my model again. So it's a procedure that's been performed through the cervix. So the cervix is the neck of the womb. So if you can see my structure clearly here, remember I said this is the vaginal canal. So that's the neck of the womb. So if it's a fibroid that's small enough that we can reach through this by gaining access through the cervix, then it can be removed in that way. But this size of fibroid is you're not going to be able to achieve that. So that is not even an option, I feel. Then, of course, the last type of surgery is a hysterectomy. And a hysterectomy is a removal of the womb. I always believe this is a last option. That's the last option. So in an instance where perhaps there's a lady who has had fibroids for all her life, and perhaps the fibroids have started to grow. So it may be that she's had her kids, she's finished having a family, but as she's grown older, the fibroids have been growing and causing more problems in terms of more bleeding, heavier bleeding, pain, and the other symptoms I mentioned at the beginning, bloating, trouble passing urine, and so on. So it's mainly symptom that's the issue. And she's not looking at fertility. And they've tried other options. They've tried different measures to address the fibroids. Either it's come back or they've not worked, and so on. So it may be that somebody would be willing to go for a hysterectomy where removing the womb is a permanent fix and really a solution to the problems of the symptoms. Of course, it's irreversible. You can't reverse a hysterectomy. So this has a lot of both emotional and physical implications that have to be considered very, very carefully. But it is one option depending on the circumstance that we're dealing with, because we didn't hear from this person who sent in this message to me, what is their circumstance, how old are they, if they're sort of in their 60s or 50s and fertility or having children is not the issue, the problem is symptoms, different from somebody who maybe in their mid-30s who doesn't have kids and wants to have children dealing with this size of fibroid. So that is, that's first category of treatment, and that's surgical. Let's move on to the next category of treatment. We've talked about myomectomy, we've talked about hysterectomy. Now let's look at what we call non-surgery alternatives, and you may have heard of some of these. They're fairly newer compared to the surgical options. One is something called uterine artery embolization, and I also have a couple of videos on this. Method is becoming more and more popular, so you might have heard of it, where you will be admitted to hospital. It's usually performed by somebody called an interventional radiologist, so somebody who's very, very specialized and experienced in carrying out this process, because what they're going to do is give you an injection that puts in tiny beads, tiny plastic-like beads into the particular blood vessels that will go to where the fibroid is located, and where that those blood vessels actually supply the fibroids. Anything in the body, blood is what supplies nourishment, carries oxygen, carries nutrients, and all the things that we need for our tissues to survive. Exactly the same with the fibroid. So they give you this treatment via a big artery in your leg that travels to where the fibroids are located, and eventually those beads in that injection that they're given will block the blood flow, and by so doing shrink the fibroids eventually. Usually over a few weeks. Good what's the word now? Quite effective, depending on the size of the fibroid. But I think I don't know how well their success against large fibroids like this is quite limited. Excuse me, getting dry. That feels better. So for the right size of fibroid, research suggests that they can shrink them by over 50% for the right size of fibroid. But this might be quite large for them to be able to achieve that. A 22 centimeter fibroid may be quite big for that purpose. So while it might be an effective procedure, let me get my phone. Okay, so while it might be an effective procedure, it may not be right, or it may not be effective for this size of fibroid. And besides, I think it's good to say that fibroids can also come back with this procedure. And of course, like any other procedure, there might be complications. There might be the risk of damage to the womb. There might be a risk of, complications like what's called post-embolization syndrome. There's also suggestions that it may affect your ovarian reserve. So we're not sure how that works. And there are still studies going on that it may affect the number of eggs that you have. The studies I've looked at so far feel it's a temporary effect on your ovarian reserve. So perhaps a few weeks or months after, the ovarian reserve picks up again. And the other thing that I've also heard is that it may affect miscarriage after the procedure. So many doctors will not recommend uterine artery embolization or uterine fibroid embolization if you're still looking to have children. They might say, that there are risks after the procedure. You may experience miscarriage, you may experience trouble getting pregnant. So you may hear this from many doctors, because the studies do suggest that after this procedure, these problems are common in women who've had the procedure. If it was only to deal with the symptoms, then it would be an effective procedure, although bear in mind that the fibroid could come back. But would I recommend this? I mean, my major concerns are, one, because of the size, this method might not be effective, and two, although I don't know the nature or what this particular person who sent in this question, I don't know their backgrounds. I don't know if they're interested in still having kids. I don't know if they're interested in just symptom control, whichever one, because it's important to know and not assume. So these are things that it'd be useful to have a chat with her doctor about. So the next one is, or the next surgery alternative, I should say, that's a better way to say it, is using MRI guided ultrasound. MRI guided focused ultrasound is what it's called, and this is basically using sound waves to destroy fibroid tissue. There's no cut, it's not an invasive procedure, and after this procedure, it's thought that fibroids can shrink by up to over 50%. Some studies suggest up to 70% shrinking of the fibroids using that procedure. It's a newer procedure. Again, we don't know, we don't have too much information. Again, that's still being studied. And my problem with this is how effective would it be for large fibroids? So something to bear in mind, something to speak to your clinician, especially if you're the kind of person who is not very keen on surgery, or you're looking at, I still want to have kids. How can I have this fibroid removed? That is an option to consider. I think the information we have at the moment suggests that it may not be very effective. And the question you have to ask yourself is, if you want to have a procedure that may carry certain complications, whether it's to relieve symptoms, beg your pardon, whether it's to relieve symptoms or whether it is because you want to restore your fertility, then you have to ask yourself, is it worthwhile having something that doesn't promise to be very effective against or with a large fibroid? There's something else that's called radiofrequency ablation treatment, which is like using heat to destroy the fibroid tissue. And that can be done either via a laparoscope. So that is where they use those small cuts I talked about at the beginning to access the womb from the abdomen. Or they might go via the cervix, or they might go via the cervix to apply the heat treatment, and that's directed against the fibroid. So you're trying to get rid of the fibroid tissue using heat. Again, it's another effective method, but it depends on the type of the fibroid. So it may be that these are fibroids that you can easily reach through the cervix, so you can target the heat specifically to the fibroid area or where the fibroid is located, and use it to destroy the fibroid tissue. But I think it's a similar question when you're employing a laparoscopic approach with a large fibroid like this. You know, the laparoscope is going to enter just through a very small hole that you make into the abdomen. There's not really much room to maneuver. So how much of it really can you remove with that method? Even though it's an effective method, it will be more effective for smaller types of fibroids. All right, guys, if you're just joining, we're talking about fibroids. We're dealing with a specific question relating to treatment options for a 22 centimeter fibroid. If you're just joining, please give this video a like and hang around, because I have a couple of other options that we need to look at that would help us to answer which are the most viable methods that one with a fibroid this size or something close to this size can actually use for treating it in 2025. I'm going to take a quick break, and then when we come back, we shall continue. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Lovely. Thank you so much. If you're just joining, don't forget to give this video a like. And if you appreciate what we do here, of course, subscribe to the channel. Thank you so much to people who engage with our videos, share comments, and ask questions. It's a learning space, and it's a safe a space I want to be safe, where you can ask any question. Don't feel your question is too, silly, or don't feel scared to ask any question. We're here to learn and support each other. So we're talking about how we can deal with large fibroids, and I brought this watermelon to demonstrate a 22 centimeter fibroid, because that is the question I was asked about, how to deal with a 22 centimeter fibroid. And I measured the melon it is over 20 centimeter, I think. So I think it's close enough. So the question is, can you recommend possible viable procedures for large fibroid removal before 22 centimeters to be exact. So before we went off on a break, we had talked about surgical options, which, you know, at the very offset, that's the most common option that you're going to be offered with this size of fibroid. And we talked about the different surgical options. Then we've just finished talking about surgery alternatives. So now let's talk about medication. Let's talk about the role of medication, because there are different medical options. And now I'm not just going to be talking about medical options to deal with symptoms, because I think that by the time somebody has a fibroid this size, they would really be having very significant symptoms that can include things like, you know, pain and bloating and so on. So we're probably well past the level of just taking painkillers. So they might be looking at controlling the bleeding. They may have used medication, hormone or non-hormone medication. For example, tranexamic acid is a medication that sometimes we use to try and control bleeding from fibroids. It may be effective for some time. And again, it's not going to shrink the fibroid. It's simply to control the bleeding, simply by the effect on the blood vessels around the womb. But then again, for a very large fibroid, if the treatment we're considering is simply to manage the symptoms caused by the fibroid, that tranexamic acid may not work for too long. So that then leads us into hormone medication, of which there are a few medications that we have. And some of them, these hormone medicines, can shrink fibroids for some time. And in fact, they are used for shrinking fibroids before surgery. So they are hormones similar to the ones that the body produces. And what they do is, by the time you're taking them regularly for a period of time, they can reduce maybe over by 20, 30%, even more, the size of the fibroid. And not only will that improve the symptoms, it may also be that is a preparation for surgery, so that when you decide to go in for surgery, it is easier for them to be able to remove the fibroids completely. So that's one way that medication can be useful. Of course, it's important that we say that these medicines, they're hormone medication. They're similar to the ones that we produce in our body, or they act in a way that can trigger some of the receptors that we have in our body and mimic some of the way that our own hormones behave. They have side effects, and this can be a big issue for many women. And I don't mean, you're taking hormones that can create more, how do I put it now? I don't mean taking hormones like birth control. No, I mean, you're clearly taking these hormones to deal with fibroids, but you could end up with side effects. For example, symptoms or effects like menopause effects in somebody who is not menopausal, simply because of the way they act, because they will go into the body, switch off our natural hormones, because they want to stop the effect of estrogen and progesterone on the fibroid, which is how they go about affecting the shrinking effect, or affecting the way to manage the symptoms. So the side effect to that happening can be developing something like hot flushes, mood changes, more common side effects that may be things like vomiting. People might experience problems with thinning bones and so on. So it's good to say that. Does it mean that one shouldn't use them? Again, it's an individual decision that you should discuss with your doctor based on your medical background to see, is this medicine suitable for you? Can you have this medicine and still have a family? Now, you can't get pregnant while you're taking these medicines, but it may be that for a period of time, it may be 6 months, it may be 12 months, you're taking this medicine to intentionally shrink the fibroid and then have surgery. And the outcome from that will be you have a period of time when you're free of the fibroids, your womb's recovered, and then, that's the chance for having, for getting pregnant. So there could be that kind of strategic, tailored approach to using these medicines. Like I said, there are different types, different forms. We've got one that's recently, in the UK at least, become licensed for treating fibroids, called Raico, which is a combination of this hormone I'm talking about. But they've added on the combined pill, or the medicines from the combined pill, to try and counter those side effects, so that actually you're getting a combination of a medicine that can help to deal with the fibroid, shrink the fibroid, manage the symptoms, but you're not dealing with the nasty side effect. I've got a video on this particular drug coming out just to answer questions, just to talk about how it works. So hopefully that video will come out soon. I think maybe in the next couple of weeks. And then, if you're interested, you can learn about that drug. Not just Ryco, there are other, different hormone medicines. Some can reduce the heavy bleeding without necessarily shrinking the fibroids. And usually they are used for short periods of time. You don't stay on them like blood pressure tablets. They're used for short period of time. Your doctor is monitoring any side effects like problems with your bones, menopause side effects, and so on. So again, it's good to understand what effect would it have on a 22 centimeter fibroid. Well, it might, because of the way they work, they might help to shrink this fibroid. They may be able to do that, shrink the fibroid, and that opens an opportunity to have myomectomy surgery that's effective in getting out as much of the fibroid as possible, allowing, if fertility is the intent, allowing you to be able to get pregnant. So that is something to consider and to converse about with your doctor. So that's as far as it goes. That's as far as it goes with medication. So I've just got a comment from Blessed Mom here. Hi, thank you so much for joining the stream and for commenting. And you say you've tried everything and the only option left after 10 years was surgery. Yeah, thank you for sharing that. Obviously, we're all different. And fibroids can affect people to one degree or the other. And I'll say many women have a similar experience to Blessed Mom, what she's saying, that you've gone from one treatment, because nobody will just push surgery onto you or just push hysterectomy onto you. We will try non-invasive things that are relatively safer, easier to tolerate, to see if that can be managed. And if that doesn't work, you get to a point where, okay, let's look at surgery, let's weigh the pros and cons, let's consider what options. And Blessed Mom is saying yes, and exactly. Yeah, thank you so much. I appreciate that you're sharing your experience. It's not easy conversation. It's not an easy conversation at all. It's a challenge for people who have to, a woman who has to go through this, and you're having to make these kind of choices that are, very painful to consider. But I also think, looking at it the other way, is, we've got some advances in medical care, medical treatment that allows us to even have these options. So how do you make the best of a situation that's not very good? You just have to make the best out of it. And I think that is what many women have to do when we're talking about fibroids. All right, so let's go to the next option for treatment, which is natural and supportive treatment. And I really want to talk about this because, thank you, Blessed Mom. Thank God. I really want to talk about this because, we have a lot of commentary on my channel, lots of conversation around fibroid options, treatment options. And I know that I have a group of viewers who are completely against the idea of surgery and hormone medicine and everything else. In fact, I had somebody who recently, I can't remember which video it was, but saying that, look, it's all about your diet. Eat wild yam or eat flaxseed and eat this and eat that. Don't eat that. Don't eat cheese. Don't eat cereal. Don't eat this. So a lot of don't do this and eat that. And if you've done something in particular, natural, for example, if you've tweaked your diet and made a lot of diet changes and it's worked for you, fine, all well and good. But please first be respectful and don't discourage other people. There's some people who have the mindset that Big Pharma is, there to and is weaponizing doctors to use us to just, because of money, only advocate for drugs and for surgery. Well, I don't have any Big Pharma associations. I'm not getting paid. I'm simply providing information based on the evidence that's available. And I think it's also, it's also painful when you find that there are many women who have had either myomectomy surgery or had drug treatment and then gone on to benefit from these methods, either from their symptom control or from, going on to have kids if that was what they wanted. But people don't want to regard that. They want to just ignore that and, just say, oh, just change your diet, just do this. And don't get me wrong, please. I'm not saying that diet is not important. Diet is very important. Of course, we know learning more and more about the possible effect of inflammation, chronic inflammation on so many different health conditions, including fibroids. We're learning more about the effect of processed foods and excess salt and sugar and, all manner of excess fats and oils and so on diet, and how it affects different conditions, not just heart disease or joints, but conditions like fibroids, endometriosis, and so on. So diet is very important, yes. But for you to sit down and say, well, all you have to do is just change your diet, go on a water fast, take alkaline water, drink this or stop eating that and do this and do that, and the fibroids will magically disappear. I don't agree with you, and I won't agree with you. And I don't think you have the right to intimidate anybody with a belief that, we haven't got the evidence for it. And if for some reason you have taken some measures and it's made some difference for you, I'm happy for you, but that doesn't mean that you should intimidate anybody or bulldoze anybody into a particular decision, which is how it sometimes appears. I'm speaking about what I see on my platform, the response to my videos. But as long as it's respectful, their opinions, we can have conversation around them. But what am I trying to say? There are people who feel that taking foods to target inflammation, herbal supplements or herbs, exercise, and so on, can tackle fibroids. Now, remember, we're talking about a 22 centimeter fibroid. And so, excuse me, would I recommend that as a treatment option for a 22 centimeter fibroid? While I agree, switching to a healthy diet. So if you're somebody who used to eat a lot of processed food, high carb, high fat, and so on, high salt and high sugar food, then you should stop that. That's very healthy. That will do amazing things for your overall health, will help to cut down your weight. We know that being overweight is associated with an increased risk of fibroids, but it will also help your blood flow, to help your heart. It will give you overall general health, even improve your mental health as well. So that is good. It's good. How much effect would it really have to shrink this fibroid? Now, you see, that's the thing. Those people are pushing that narrative that doing that alone can shrink this fibroid. We don't have the evidence for that. And doing that in addition to other options is what we'd recommend. I definitely say that you should look at, cutting down on unhealthy foods, cutting down on smoking, promoting use of supplements like green tea, for example, or vitamin D, for example, where we have seen small evidence that suggests some benefit to controlling symptoms. I'd recommend doing that with medical or surgical options, for overall, to get the best out, best care possible. But sticking to just that alone, and sort of sitting with diet options for 2-3 years, because while you're doing that, you're growing older. If you're someone looking for fertility, trying to have a child, your fertility is declining while you're sort of sitting there waiting for diet and all that to shrink your fibroids. Some people talk about exercises. Of course, exercise is good. Yoga, these can actually help to control some fibroid symptoms. I think I have a couple of videos where we looked at different natural measures that you can take to help yourself to control your symptoms. And I always suggest that they can be done in collaboration with other medical or surgical treatments. Or if you had smaller, moderate sized fibroids and you wanted to deal with how do you manage pain, as long as your doctor has looked into it, we've checked that the fibroid position is not causing significant damage to your kidneys or to your bowels and so on, and you want to try these measures to help to live better and possibly improve your symptom, I think that's reasonable. The impact of having conditions like fibroids, these are long-term chronic conditions. They can weigh on the mind. The stress can weigh on the mind. So yes, yoga can help, exercise can help with that, cutting down stress in different ways. That removes the effect of cortisol that would otherwise promote chronic stress and even worsen symptoms. So natural remedies, in as much as people believe how effective they are safer, but would they actually shrink a 22 cm fibroid? No, we don't have any evidence, but they can help to support your overall well-being. They can help to support your recovery if you've had surgery. They have a role, but please don't say that, do this and it will shrink the fibroid. Let me put this down. My hands are hurting now. So let me know what you guys think. I think what's also important is we've talked about diet, haven't we? So high fiber foods, anti-inflammatory foods, like I said, vitamin D, all of these can help to regulate hormones. We talked about exercise, yoga. Some people have talked about acupuncture as well. But yes, let me know what you think. This was a question that was presented to us by a viewer. So I will post the link to this video in my response to this viewer. We're looking at possible viable procedures for large fibroid removal. So first of all, you should have a conversation with your own doctor. We cannot specifically advise you. We don't know your medical background. We don't know how old you are. We don't know anything. We just know that you're dealing with this challenge. And so we've looked at the different measures, and those different measures include surgery, non-surgical alternatives, medication, and natural options or complementary treatments that cover diet, herbal therapy, what's it called? Castor oil packs, for example. I'm just trying to remember different ones. Like I said, I've got videos on these subjects where I go into a lot more detail. So it would be great, to look at them. Which of these measures? So I would support if your specialist is talking about a myomectomy, but a strategic myomectomy, looking at if it's fertility that we want to deal with, the time when you're going to have the myomectomy. They may give you medication to help to shrink the fibroids first, and so the myomectomy is simpler. They're not having to dig in too much or work too hard to remove it, and perhaps reduce the risk of scarring that could affect the womb. So the medication can be quite useful for that. Then have the myomectomy by the time you've recovered. And yes, we know the fibroid may go back, but there's a space before it does that. And so there's that window for fertility if that is what the intention is. And so I think that's one approach that your specialist will want to consider. The other measures, we've seen that they're not so effective. So it's about sitting down and thinking of what is it that you would prefer? What can you live with? What can you tolerate? What are your goals? What do you want to get out of this? Is it just to get rid of this? You've had this for years and years and years. You just want to get rid of the symptoms. Then the hysterectomy may be something that's of a choice for you because you've had your kids and you just want and you deserve to be able to live life free without having to experience the pain and all that associated with the symptoms. Guys, let me know what you think. I have one more word from our blessed mom. Thank you so much. On point 100%. I appreciate your support. Yeah, I know that there may be some who don't agree with you, which is fine. As long as it's respectful, we can share opinions, look at what evidence is available to support those opinions. But these are my thoughts. I'd love to know what you guys feel. I'm going to sign off here. I think I've spent longer than I planned. Please give this video a like if you stayed up all the way to this point to encourage me to come back and do more of these breakdowns. Anyway, I hope you have a very great week. Look forward to seeing you again. We've got a video coming out later on this week and hopefully another live stream. It might be on Monday next week or Sunday. And yes, I'll be seeing you guys again soon. Thank you so much, Blessed Mom. Thank you for being my guest and commentator on this particular live stream. I really appreciate that. Can't tell you how much I appreciate it. Thank you so much for spending some time with me. All the very best. Take care. Bye-bye, everybody. Bye-bye. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.